Hi dear students, myself Dr. Parv and I am your pediatric faculty. The topic of discussion for today's class is going to be from Pediatric Neurology, and the name of the topic is Infantile Spinal Muscular Atrophy. Infantile Spinal Muscular Atrophy, and the name which we speak generally is SMA, that is Spinal Muscular Atrophy. So what happens in spinal muscular atrophy, as the name suggests, that the muscles which are being supplied by the spinal nerves are going to get atrophied. And since the muscles are getting atrophied, of course you can remember that these are supplying by the spinal nerve. So this is actually the lower motor neuron disease. Okay, this is the lower motor neuron disease. So what is going to happen, either the babies will be a floppy baby because the spinal muscles are not having much strength. So either there will be a floppy baby, or the baby is going to have a frog leg position. Can you see, like this frog leg position? Or the baby is going to have impaired head control. So can you see the baby is having what? The baby is having the impaired head control. So what actually happens is, so I just hope that you know that if this is your spine, so this is the, okay, let me just make it, yeah, if this is your spine, so there here will be the anterior horn cells which are going to be there, anterior horn cells. Okay, so anterior horn cells are going to be there in this domain, in this part. So in SMA what happens, there is a selective loss of anterior horn cells, and of course there will be motor nuclei which will be selectively lost in the brainstem also. So now you can understand that since anterior horn cells, spinal nerves are gone, this is thought to be a element disease. But can you understand that there are some motor nuclei loss which is there in the brainstem also? So there is going to be UMN issue as well. So common form is actually the infantile SMA, and that is called as Werdnig-Hoffmann disease, which is actually most common. The issue is that it is rapidly fatal also. It is autosomal recessive, and from SMA, spinal muscular atrophy, you can remember SMN, that is spinal muscular neuron 1 gene, which is degenerated. And since it is degenerated, there will be muscle atrophy, weakness, and in fact respiratory failure can also occur, and that is why it is thought to be, it is the reason why it is fatal as well. So pattern of weakness, first of all, proximal muscles are involved like this, and then the distal muscles are going to be involved. But firstly lower limbs are involved, then the upper limbs are involved, and initially the lower limbs and then the upper limbs. This is something which is termed as ascending paralysis, which is actually a feature of GBS, okay, Guillain-Barré syndrome, feature of GBS, okay. So this is something which you have to be very vigilant. Like whenever they say that it's starting from the lower limb coming to the upper limb, doesn't mean that it's a GBS only, it can be SMA as well. But you have to remember that it is more in the proximal, starts in the proximal group of muscles and then goes to the distal part. Now, since it is an element lesion, there is going to be decreased deep tendon reflexes, there is decreased or absent fetal movement in third trimester, there is flaccid paralysis which is going to be there, the suck, the cry, the swallow is going to be poor, the tongue is going to show fasciculations, there will be oral secretions can be going into the your larynx, into your trachea, and aspiration can happen. Upper cranial nerves are actually spared. So remember that the eye, the upper facial muscles are actually preserved, eye muscles are all good, but the problem is the problem is going to be the lower facial nerves, okay, lower facial nerves. So there is poor bulbar function which is going to be there, because I think you know that in seventh nerve these lower parts is actually something which is controlled by UMN. So yeah, bulbar function is lost, but then upper part is comparatively fine. So of course there will be, in the respiratory findings, there will be intercostal weakness, the diaphragm is also not going to function properly, there will be bell-shaped chest which is going to be there, and clinically you can see that the child will have hypotonia, weakness, weak cry, poor feeding, all these things can happen. So how will you see this? So you have to perform a EMG. What is EMG? That is called as electromyogram. So electromyogram is performed, and electromyogram is going to show, myo means muscle, it is going to show you low waves. Okay, why low waves? Because the muscle is not having the strength. Normal nerve conduction, because it's not a neuronal disease. I mean, it's a neuronal disease, but then mostly it is going to get manifested when the muscles are getting atrophied. That's why by the time the nerves might be, regenerate, but muscles are actually gone, atrophied. Okay, so muscle biopsy will also show you atrophy. Genetic counseling genetic testing might show SMN1 gene deletion. Okay, so what is that treatment? This is an FMGE question which was asked. This is a NEET or INI-CET, some central institute exam question. Nusinersen is something which is given in what? Nusinersen is something which is given in SMA. Nusinersen. Okay, nusinersen. It's actually an antisense oligonucleotide, okay, which is given intrathecal, but nusinersen is important. Please don't forget this. And how nusinersen acts? So there is something which is called as pre-mRNA, okay, which is pre-mRNA is something which is responsible for splicing of SMN2 gene. So once this splicing of SMN2 gene occurs, there is increase in the protein, SMN2 protein is going to increase, and that is going to compensate the SMN1 loss. Okay, so you have to provide a lot of protein materials and everything. Aggressive nutritional and respiratory support is something which is desired in case of children who are suffering from SMA. Please don't forget about nusinersen. This is important, and please don't forget about the LMN plus UMN paralysis. And I have told you that the lower face is going to get involved in LMN. Of course, the features like fasciculations, weakness, all these things, the DTR loss, everything is going to be counted in this. So thank you so much, and God bless you. Please stay tuned.